No medical crisis ever stressed her out. Sarah Martinez handled rural clinic cases with perfect medical protocol, even in the most desperate moments. They called it natural healing touch. In reality, she had been trained for much more deadly injuries, until that day when she had to use this training outside the battlefield. Welcome to Hidden Hero Stories. Before we begin this incredible Army Ranger medic story, tell me in the comments which city you're watching from today. And if you believe stories like these hidden heroes need to be heard, hit that subscribe button and help us keep these stories alive. In the rolling hills of rural Kentucky, Millbrook Community Clinic served as the medical lifeline for 3 small towns scattered across the countryside. Sarah "Doc" Martinez, the 42-year-old head nurse responsible for emergency care at this modest facility, was known throughout the community as the most competent medical professional they'd ever worked with. Sarah had been working as a nurse at Millbrook Clinic for 7 years. Every day she would arrive at 6 a.m. and work until 8 p.m., handling everything from routine checkups to serious medical emergencies. Calm, efficient, never showing stress under pressure. "Sarah is an exceptional nurse," said Dr. Robert Chen, the clinic's director. "In 7 years, I've never seen her panic or lose composure, even in the most critical situations. She has this incredible medical intuition." This was true. Sarah handled every medical case that came through the clinic with remarkable precision. Heart attacks, severe injuries, pediatric emergencies, complex trauma cases. Nothing seemed to challenge her. She moved with the confidence of someone who had seen much worse. Sarah's office was a small room adjacent to the emergency treatment area. Inside was organized with military precision. On her desk were treatment protocols, emergency contact lists, and patient charts. But in her locked desk drawer, there was a small medal that no one knew about. Every morning she would start work with the same systematic routine. She would check all emergency equipment, review patient schedules, and ensure every medical supply was properly stocked. She never missed a detail, never showed fatigue. Sarah's most striking characteristic was how she approached medical emergencies. Her triage decisions were flawless, her treatment prioritization was perfect, and her ability to remain calm while saving lives was extraordinary. She moved like a natural combat medic. "Sarah's medical skills are incredible," said Janet Williams, a fellow nurse. "She can assess a patient in seconds and know exactly what needs to be done. It's like she's done this 1,000 times before." That humid Thursday morning in July, Sarah was starting her normal shift when Dr. Chen called an emergency staff meeting. "We've received word that there's been a major accident on Highway 9, Dr. Chen announced. "Multiple vehicles involved. We need to prepare for mass casualties." Sarah immediately shifted into emergency mode. "How many casualties are we expecting?" "At least 12, possibly more. Some critical." "I'll prepare triage stations and coordinate medical response," Sarah said with calm authority. Dr. Chen was impressed by her immediate leadership. "Sarah, can you handle coordinating the emergency response?" "Absolutely. I'll set up priority treatment areas and organize medical flow." Within minutes, Sarah had transformed the small clinic into an efficient trauma center. She established triage zones, organized medical supplies by priority, and briefed the staff on mass casualty protocols that seemed far beyond a rural clinic's normal procedures. "Sarah, how do you know these emergency protocols?" asked nurse practitioner Lisa Rodriguez. "Medical training. We need to focus on the incoming patients." At 11:30 a.m., the first ambulance arrived. The paramedic Tom Bradley quickly briefed Sarah on the casualties. "We have a school bus collision with 2 cars, 18 total casualties ranging from minor to critical. The most severe cases are coming in first." Sarah assessed the situation instantly. "Bring the critical cases to Trauma Bay 1, moderate injuries to Treatment Room 2, minor injuries to waiting area for evaluation." The first patient was a 12-year-old boy with severe abdominal trauma and potential internal bleeding. Sarah immediately began assessment. "Pulse thready, blood pressure dropping, signs of internal hemorrhage," she announced. "We need immediate surgical consultation and blood typing." Dr. Chen was amazed at her rapid diagnosis. "Sarah, that's exactly right. How did you assess so quickly?" "Pattern recognition. This patient needs emergency surgery." The second patient was an elderly woman with multiple fractures and head trauma. Sarah quickly performed neurological assessment. Possible traumatic brain injury, multiple rib fractures, likely pneumothorax. We need chest tube insertion and neurology consult. As more patients arrived, Sarah coordinated the medical response with the precision of a battlefield commander. She triaged patients, directed treatment priorities, and managed medical resources with extraordinary efficiency. Patient after patient came through the doors. A teenage girl with compound fractures, a middle-aged man with cardiac distress from the trauma, a young mother with severe lacerations, children with various injuries ranging from minor cuts to serious trauma. "Sarah, the trauma load is overwhelming," said Dr. Chen. "How are you managing this so efficiently?" "Training and experience," Sarah replied, continuing to work on a patient with severe bleeding. What struck everyone was not just Sarah's medical competence, but her leadership under extreme pressure. She directed other medical staff, coordinated with paramedics, and managed patient flow like someone who had done this countless times before. "Get me 2 units of O-negative blood for the abdominal trauma," she called out, "and prepare emergency surgery for the head injury patient." "Sarah, we don't have surgical facilities here," reminded Dr. Chen. "Then we need immediate medical evacuation to the trauma center. I'll stabilize for transport." As Sarah worked on the most critical patients, her movements were precise, confident, and remarkably efficient. She seemed to anticipate medical needs before they became critical. The 5th patient was a construction worker with severe crush injuries to his leg. Sarah immediately recognized the severity. "This is compartment syndrome. We need emergency fasciotomy or he'll lose the leg." Dr. Chen was surprised. "Sarah, compartment syndrome diagnosis usually takes more extensive evaluation." "Not when you've seen it before, multiple times." Sarah began emergency treatment to save the man's leg, using techniques that seemed far beyond standard nursing protocols. "Where did you learn these advanced trauma procedures?" asked Dr. Chen. Sarah paused, then continued working. "Military medical training, long time ago." As the emergency continued, Sarah's background became increasingly obvious to everyone watching. Her medical knowledge, leadership skills, and ability to handle mass casualties revealed training far beyond civilian nursing. After 3 hours of intensive emergency care, all 18 patients had been treated, stabilized, and either released or transferred to appropriate facilities. Not a single life was lost. Dr. Chen approached Sarah as she was cleaning up. "Sarah, I need to ask you something. What kind of military medical training did you have?" Sarah hesitated. She had kept her military background private for 7 years, but after today's display of her skills, hiding was no longer possible. "Army Ranger Medic, 12 years active duty." Dr. Chen's eyes widened. "You were a Ranger Medic?" 75th Ranger Regiment, 2005 to 2017. "That's incredible. Why didn't you ever mention this?" "Because that life is behind me. I'm a civilian nurse now." Dr. Chen was curious about her background. "How did you become a Ranger Medic?" Sarah began to tell her story. "I joined the Army as a combat medic in 2003, right after nursing school. I wanted to serve and help people." "How did you get selected for Rangers?" "In 2005, they opened Ranger training to medics. I applied and made it through the selection process." Dr. Chen was impressed. Ranger training is extremely difficult, especially for medics. "It was the hardest thing I'd ever done. Physical training, medical training, combat training, survival skills, everything designed to prepare medics for the most dangerous missions." "What kind of missions did you go on?" Sarah's expression became serious. "Direct action raids, reconnaissance missions, hostage rescues. Anywhere Rangers went, they needed medical support." "How many deployments did you have?" 6 deployments to Afghanistan and Iraq. 12 years of continuous operations." Dr. Chen was amazed. "That's an incredible amount of combat experience." Every deployment was different, but the medical challenges were always the same: save lives under the worst possible conditions. "What was your most challenging medical case?" Sarah thought carefully. "IED explosion in Afghanistan, 2012. 8 Rangers wounded, multiple critical injuries. I had to perform emergency surgery in the field with limited supplies." "How did you manage?" "Ranger medical training teaches you to improvise. You use whatever you have to save lives." Dr. Chen was curious about her medical capabilities. "What procedures were you qualified to perform?" "Everything from basic first aid to emergency surgery. Combat medics have expanded scope of practice because evacuation isn't always possible." "That explains your incredible skills today." Sarah nodded. When you've treated gunshot wounds, blast injuries, and severe trauma under enemy fire, civilian medical emergencies become manageable. Why did you leave the Rangers? Sarah's expression darkened. My last mission in 2017. We took heavy casualties. I couldn't save everyone. What happened? Ambush in eastern Afghanistan. 5 Rangers wounded, 2 critically. Despite everything I did, we lost 2 good soldiers. Dr. Chen understood Sarah's pain. That wasn't your fault. I was the medic. Their lives were my responsibility. Sarah, in medicine we can't save everyone. That's not failure. Maybe, but after 12 years I was mentally and emotionally exhausted. I needed to step away from combat medicine. Dr. Chen appreciated Sarah's honesty. So you chose civilian nursing? I still wanted to help people, but in a peaceful environment. Small-town medicine seemed like the right transition. Do you miss military service? Sarah considered the question. I miss the team, the sense of purpose, but I don't miss the constant danger and trauma. How did today feel, using your combat medical skills? Natural, but also emotional. It reminded me why I became a medic, to save lives. That evening, word of Sarah's heroic medical response spread throughout the community. Local news covered the story of the mass casualty incident and the nurse who coordinated the life-saving response. But Sarah didn't want publicity. She preferred to continue her quiet service. The next week, patients and families began visiting the clinic specifically to thank Sarah. Nurse Martinez, you saved my daughter's life, said Mrs. Peterson, whose 12-year-old daughter had been one of the critical patients. I just did my job, Sarah replied. No, you did much more than that. You're a hero. Sarah felt uncomfortable with the praise. I'm just a nurse doing what nurses do, but the community saw her differently now. They understood that their quiet, competent nurse was actually one of the most highly trained medical professionals in the country. Dr. Chen offered Sarah a promotion. Sarah, I'd like you to become our emergency services coordinator. Your skills are too valuable not to utilize fully. I appreciate the offer, but I'm happy being a floor nurse. Why don't you want more responsibility? Because I found peace in simple nursing care. I don't need to be in charge anymore. Dr. Chen respected her choice, but continued to rely on her expertise. Several weeks later, a team of Army recruiters visited the clinic. Nurse Martinez, we'd like to talk to you about returning to active duty. The Army needs experienced Ranger medics. Sarah politely declined. Thank you, but my military service is complete. Why not come back? Your skills could save countless soldiers' lives. I save lives here too, in a different way. The recruiters persisted. The Army would offer you immediate promotion and choice of assignment. I appreciate the offer, but I found my calling in civilian medicine. After they left, Dr. Chen asked Sarah about her decision. Do you ever regret leaving the military? Sarah thought carefully. I served my country for 12 years. Now I serve my community. Both are important. How do you use your Ranger medical training in civilian practice? The fundamentals are the same. Assess quickly, treat efficiently, save lives. The setting is just different. What's the biggest difference between combat medicine and civilian nursing? In combat, you're focused on immediate survival. In civilian medicine, you can focus on long-term healing. Dr. Chen found her perspective valuable. Would you be willing to train other nurses in emergency response? I'd be happy to share what I know. Sarah began conducting emergency medical training for clinic staff and local first responders. Her classes covered mass casualty response, advanced trauma care, and emergency leadership. The key to emergency medicine is staying calm, she would tell trainees. Panic kills patients. Competence saves lives. How do you stay calm in crisis situations? Training and experience. When you've practiced something hundreds of times, it becomes automatic. Her training sessions became popular throughout the region. Emergency responders, nurses, and doctors came to learn from the former Ranger medic. Sarah's training is incredible, said paramedic Tom Bradley. She teaches techniques I've never seen in civilian medicine. Where did you learn these methods? Military medicine operates under different constraints. You learn to be resourceful and efficient. 6 months after the highway accident, Sarah received a community service award for her medical leadership during the crisis. At the ceremony, she was introduced by Dr. Chen. Sarah Martinez represents the best of military service transitioning to civilian care. She brings elite medical training to serve our community with humility and dedication. Sarah spoke briefly. I'm honored to serve this community. Every day, I get to use my training to help people heal and recover. That's a privilege. After the ceremony, several military families approached her. "Thank you for your service," said retired Army Sergeant Mike Rodriguez. "Rangers like you kept us alive over there." Sarah was moved by their gratitude. "We all served together. We all did our part. Do you stay in touch with your Ranger unit?" "Some of them. We share a bond that never goes away." "How many lives do you think you saved during your military service?" Sarah considered the question. "I don't keep count. Every life matters." Today, Sarah Martinez continues working as a nurse at Millbrook Community Clinic, but now her identity as a former Army Ranger medic is known throughout the community. Patients trust her completely. Fellow medical professionals seek her advice. The community takes pride in having such an accomplished veteran serving their medical needs. But Sarah remains the same humble, dedicated nurse she always was. "I just take care of people," she says. Whether it was Rangers in Afghanistan or families in Kentucky, the mission is the same: heal, comfort, and save lives. Sarah's motto: "Medicine is about service, not glory." And every day, she uses her elite Ranger medical training to provide compassionate care in a peaceful setting. Combat medicine skills now serve civilian healing. Sarah Martinez served 12 years as an Army Ranger medic, conducting medical operations in the world's most dangerous places. She treated hundreds of wounded soldiers under enemy fire, performed emergency surgery in impossible conditions, and saved countless lives. Now, she uses those same skills to care for rural families, bringing elite medical expertise to a community that needs it. Because true healers continue their mission regardless of the setting. The uniform changes, but the commitment to saving lives remains constant. As Hidden Hero Stories, we ask you, have you ever met someone like Sarah? A medical professional whose military background brought extraordinary skills to civilian healthcare? Have you appreciated the veterans in healthcare who served first in combat, then chose to serve in healing? Share in the comments. Because in our communities, there are healers with incredible backgrounds who chose peaceful service after years of battlefield medicine. Thank you for watching. If this story touched you, subscribe and share. Because real heroes don't seek recognition. They just keep saving lives wherever they're needed. We'll see you in the next one. Until then, show extra respect to the healthcare workers around you. They might be carrying incredible stories of service and sacrifice.